Hello, this is Dr. David Green, CEO of the U.S. Rehab Network. Today's topic is the facts on teenagers and drug abuse. Let's look at the scope of the problem. By the 12th grade, half of adolescents have used an illicit drug at least once. Those who experience between the ages of 8 and 10 years old are 500% more likely to develop an addiction problem later. 40% of those who started drinking before the age of 14 develop an alcohol dependence issue, compared to only 10% after the age of 17. Being male is a risk factor as far as the quantity of those who get addicted. However, progression occurs faster in females. Family history, along with genetic, we know has a huge predisposition to who ends up with an addiction. Having a mental health disorder, when you have mental health plus substance abuse disorder, it's known as dual diagnosis, very common concomitant issue there, whether it's ADHD, PTSD, depression, anxiety, antisocial. Having a difficult family situation is a risk factor. Could be trauma, abuse, neglect. Those who have anxiety, depression, or loneliness. And then those who undergo surgery or have a trauma take prescription medications and then are not able to get off of them and fall into an addiction. Drug overdoses kill more than cars, guns, and falling now. Drug overdoses in this country lead to 41,340 deaths, which is more than traffic accidents, guns, and falling. You can see the numbers there. It's crazy. Now here's the dirty dozen, 12 reasons that teens use prescription drugs. In large surveys, they've asked teens, why did you do it? And in descending order, these are the reasons. Number one is that it's easy to get from the parents' medicine cabinets, all right? Number two is that they're available everywhere. Number three is that the feeling among teens is that they are not illegal drugs. Number four, easy to get through other people's prescriptions. Number five, they can claim to have a prescription if they get caught. Number six is they are cheap. Seven is that they're safer to use than illegal drugs. That's the thinking. Number eight is there's less shame attached to using prescription drugs. Number nine, easy to purchase over the internet. Number 10, fewer side effects than street drugs. Number 11, they can be used as study aids. And number 12 is parents don't care as much if they get caught with a prescription drug versus an illicit one. Now, where do the kids get drugs? Now, here's the breakdown. 54% get free from a friend or a relative. 18% obtain them from one doctor. 17% bought or took them from a friend or relative. 4% bought from a drug dealer or a stranger. 2% obtained from more than one doctor. And only 0.3% bought them online. It's gotten harder and harder, unless they're on like the deep web or something, where that's possible. Prescription drugs are not going away. Every 15 minutes, an American dies from an unattended drug overdose, which is mostly from prescription drugs. Unintentional drug overdoses are now the leading cause of accidental death in the U.S. We are 5% of the world's population, yet we consume 75% of the world's prescription drugs. When parents speak with teenage kids about drug use, they are 42% less likely to use drugs and go on to having an addiction problem. The U.S. Rehab Network offers over 100 private rehab centers nationwide, some of which have specific programs for teens and adolescents. The steps involved involve an extensive intake process. We take care of all of that. And then the actual detox, and then the inpatient rehab, which may last 30, 60, 90 days, and then an intensive outpatient recovery to maintain sobriety. Treatment can truly be private. Parents who find their teenage kids mired in addiction can seek confidential treatment. There are two reasons. In addition to the Health Insurance Portability and Accountability Act, HIPAA, records for patients undergoing treatment for substance abuse are protected under Title 42 in the Code of Federal Regulations. Okay? The best drug and alcohol rehab centers offer both inpatient and outpatient treatments for the highest success rates. The U.S. Rehab Network offers top treatment at over 100 rehab centers nationwide. Keep in mind that the average success at rehab centers nationwide is 30 to 50%. Those in our network are upwards of 80 to 90%, so they're pretty much double the average success rates. We have immediate insurance verifications available. We take care of all the arrangements that are necessary. Call us today at 888-598-0909 and visit us for more information at usrehabnetwork.com. Because your recovery starts here.